Hi, it's Dr. Noel Williams, Oklahoma City, Oklahoma, Optimal Health Associates, COVID update. So I'll start doing COVID updates a little more regularly. I'll do one probably tomorrow and Sunday. I'll answer questions tomorrow. If you have any questions, please send them to us and I will do my best to answer them tomorrow. So what's going on? Well, we've had an uptick of cases somewhere as high as 1,000 one day this last week, more in the 700s. The cases are predominantly in Oklahoma, more northeast and then southeast, the eastern part of the state, and then all the way up in the panhandle. So that's because those people didn't get vaccinated. They have the lowest vaccination rates in the state. And so that's A, and then B, we had the Delta variant, which is not really that much more infective. It's a little more infected, but there's been lots of them that have been more infective than the average. What's the problem is that there was July 4th. And July 4th, a lot of people got together and the variant was here. And so people got infected, and the people who are getting predominantly infected are unvaccinated people. Yes, some vaccinated people, I've had 5 so far that I know of, have gotten infected. They did very well. They had no sequelae or side effects. They had brief illnesses. There's probably a lot more of those people than you can shake a stick at, because most of them are going to be asymptomatic or have something so mild it doesn't matter. Likewise, it's the same for the previously infected. And again, when I say that, it's because of the published medical literature, or you can always refer to Fauci's office, the National Institute of Allergy and Infectious Disease, to Dr. Andrew Red published the paper showing immunity for both the variant, for the current variants, which included, I believe, the Delta and the Lambda, because those have been around for 8 months, and they were looking at all of them, and the vaccinated, and that's why Fauci said again this last week that there's no need for a booster. The booster is completely unnecessary for you, because the bottom line is if you've been vaccinated, your prevention of serious illness is 99.99%. You can't get higher than that. You can't get higher than that. Now, you have to look at people with immune defects. If you have an immune defect, you need to be aware of this and make sure you get your antibody levels checked. If you're on biologics for chemotherapy, or for rheumatologic disease, or you're on chemotherapy for cancer, you have to make sure your vaccine took. Likewise, if you got COVID and you're in those situations, again, you want to get your antibodies checked. And in my book, if you have any antibodies, you're fine, because that's what the data shows. I mean, if you ever have any antibodies at a certain time. So what's the problem? The problem is people aren't getting vaccinated, and so they're getting the infection, which is the old-fashioned way. The problem with that is you can get really sick, and you could potentially have long-term damage, long haul syndrome, damage to your lungs, your heart, and all that stuff. So all of us in the task force, and the task force is meeting this upcoming Tuesday with the state again to kind of come up with some ideas to improve vaccination rates. And I'll tell you what my theory is on it. You have to get vaccinated. And so who should get vaccinated? I think anyone over 30 should get vaccinated at this point. The Delta variant is getting a little bit more young people. I think it would even be reasonable if you're in your 20s. I'm very, very, very strong against experimental vaccines in pediatrics, period. That's how I feel. There's not going to be anything that moves me off that until the vaccine's been out for a minimum of 4 to 5 years, and probably 10 to 15. You just wouldn't do it. Plus the kids aren't getting that sick. They're getting a little more sick with Delta. But again, make sure they're up to date on their immunizations. I mean, if you're someone who doesn't immunize your kids, they're going to have very little chance of having protection against the Delta, but most of the time they'll do fine. Make sure they're on their vitamins. Okay, vitamins matter, and hopefully that won't get me taken down by Facebook, since we're now, as Joe Biden's press secretary said, they're going to get rid of all misinformation about COVID, which includes all scientific facts about immunology, because since that's what they do. It's not just the people who say yes, vaccines are bad. They're going to get rid of everyone who promotes anything that's true science that doesn't match what their perception of what they want you to do is, but be that as it may. So one of the things to keep in mind too is if you've been vaccinated or you've been infected or you haven't, you need to be taking your vitamins again. I mean, get your immune system revved up. I've never gone off mine. I don't take as much zinc. I only take it a couple times a week now. But I take my multi, I take my vitamin D, I take my fish oil, and I take my multi is awesome, whatever. And so I'm in really fine feather. And, plus I do a lot of other things. So between the immunization, my cross immunity from the other vaccines I've gotten, and all this stuff, I'm in pretty good shape. And you know what else? I'll get treated with ivermectin and doxycycline if I get it. And so that's the other thing to keep in mind. Find a doctor who will treat you if you get it. I mean, it's simple. Ivermectin, doxycycline. Very straightforward. If there's a problem with ivermectin, doxycycline, you can do Plaquenil doxycycline. Whatever. You can do it for prophylaxis. You can do it for therapy. There was a meta-analysis on ivermectin. It was awesome. It showed awesome effects. That may get this post taken down, but I can't help it. It's science. But that is what you need to know. You need to have a plan. Have a plan if you get it. I mean, you can go online to get the ivermectin. There's plenty of websites set up now for getting packages of this stuff if you get COVID. It's not as good as just being able to call your doctor's office, have a telemedicine appointment and get it. But hey, that's what we do. But again, we're outliers. So that's what you have to start thinking about. But don't panic. Don't panic about Delta. It's going to be okay. But if you haven't been vaccinated, it's a mistake. You are going to be at high risk for getting COVID. And the thing you have to keep in mind too, that your sympathy level, unfortunately, and this is reality, so try to speak what reality is. No medical person, they'll take good care of you, but they're not going to feel sorry for you because the empathy's gone for these people who've been doing this so long, and so they have zero empathy for people who get infected who haven't gotten the vaccine. And so you just have to be aware of that. So they'll take care of you, but don't think there's going to be bells and whistles for you. You got to know that. The people I know who still take care of COVID patients are tired, they're burned out, and they want everyone to get vaccinated. So how are we going to get people vaccinated who won't get vaccinated? Pretty much everybody knows the facts. Everyone's heard about the Delta, or most people have. There's going to be the Lambda, and there's going to be more, and the variants are going to continue until we have enough people infected or vaccinated. So this is what we have to do. We have to come up with a system to entice them to do it. So I'm for what I'm going to propose. Kim's laughing. In our task force meeting, education isn't going to help. It's not going to help. I think we have to do what some of these other countries have done. I think you either give a vaccine at a bar, so you get a shot, you give a shot, or give a shot, get a shot, whatever. So you get, some of you may not like that, but we got to get these people who won't get vaccinated. How about you give them a lottery ticket if they get vaccinated? We have to come up with some enticement for the 60% of the adult population in Oklahoma, or 50% of the adult population in Oklahoma who haven't been vaccinated. So we have to entice them. It isn't going to be education. And I don't think you can mandate it because that just is not the American way. Some of you would disagree with that, but I feel very strongly about that too. I think we have to entice people, and then they got to live with the consequences of getting COVID if they don't get vaccinated, and the risk of serious illness and death. So that's where I'm coming from on all of it. So stay calm, be happy, have a great weekend. It's going to be hot, hot, hot here this weekend, and I'll answer questions tomorrow. But get on your vitamins again. If you've been kind of lackadaisical about them, get back on them. It takes a week to get your immune system more revved up. It's a very fast thing.
And you're saying that whether you're vaccinated or not?
Whether you're vaccinated or not, because there's always a chance you can get a secondary infection. We're seeing, an infection. And since I've seen now 5 people with the vaccine get mild infections, and I'll talk about one young lady, and she probably has an immune defect, got reinfected after the vaccine, but she'd already been infected, so she probably has an immune defect. But we put her on ivermectin, she was better under 48 hours. And maybe she would have been anyway, but it's sure nice that this time when she got infected, compared to the first time she got infected, that she was really sick, and then the ivermectin went like that instead of having a 7-day illness, So, and that's what we see with ivermectin. So that's our experience clinically. That's what the data shows. The FDA doesn't want anything to do with it, most likely because if ivermectin's effective and they show it's effective, then they can't continue the emergency use authorization for the vaccines, because the vaccines can only be emergency use if there's no safe therapy. Ivermectin's safe. Anyone who says it's not is an idiot. Okay, just to be clear. And any doctor who says that ivermectin at the doses we use it for has never read a journal article, knows nothing about it. It is just being a mouthpiece for whatever silly thing they're being. So that's the summary. Big shout out to my COVID task force people for getting re-involved, in the state for recognizing pretty quickly we needed to get the team together. As Lance Fry said this week, yeah, it's time to get the band together again. We got to start working on the state and getting the vaccine rates up. So that's what we'll do next week, and I'll report back tomorrow on questions, and you all take care and be safe. Good night.